Hey guys, and welcome back to Confessions of a Doctorholic. If you're new here, my name is Hafsa and I'm a general surgery resident in the States. And this podcast is basically my personal journal of what life behind the scenes inside the hospital actually looks like. Not the polished version, the real version. The messy, fascinating, sometimes funny, sometimes intense reality of learning how to become a surgeon. And today I want to tell you about something that happened during my first week on the burn rotation. Now, before this rotation, I had obviously learned about burns in medical school and then a little bit more in residency. We studied the physiology, we learned the formulas for fluid resuscitation, we memorized the classifications, first degree, second degree, third degree. But what no one really prepares you for is what the OR actually feels like in real life, because it is a completely different environment compared to most other operating rooms. And I learned that very quickly during my first burn case. So the patient in this case had been injured when her furnace exploded. She had burns involving her face, ears, neck, back, and arms. When burn patients come in with injuries like that, one of the first surgical steps is often something called debridement. And essentially what that means is removing the dead tissue, because burn tissue doesn't heal. And if it stays there, it increases infection risk and prevents healthy skin from regenerating. And also your body has this angry reaction to it. You get fevers, your heart rate goes up. Some people, if it's bad enough, they also get low blood pressure. So the goal is to remove the damaged tissue until you reach healthy, viable tissue that can either heal on its own or accept a graft. That was the procedure we were going into the OR to do. Now, before we even started the operation, I noticed something immediately. The operating room was very, very warm. And there's a very important reason for that. Burn patients lose their ability to regulate temperature because their skin barrier has been damaged. So burn units, and especially burn operating rooms, are intentionally kept warmer than normal ORs to prevent hypothermia in the patient, which makes complete sense. But what that also means is that everyone else in the room is essentially operating inside what feels like a furnace. So picture this. You're wearing scrubs, then a surgical gown, then sterile gloves. Some people wear undershirts as well. And you're standing under very bright surgical lights. And the room itself is already warm. At first when we walked in, I thought, okay, this is okay, not my preference, but it's manageable. But as the case went on, it started to feel warmer and warmer. And then we started the actual procedure. The attending handed me an instrument used for burn debridement. It's a small tool that's sharp on both sides. We hold it almost like a scraper. And the goal is to gently remove the layers of damaged tissue. The way surgeons know they've reached healthy tissue is something called pinpoint bleeding. That's when you see tiny little spots of blood appearing, which tells you that you've reached living tissue with blood supply. And visually, the process is pretty intense because you're essentially peeling away layers of burned tissue. It almost looks like peeling a potato, except obviously much more delicate and controlled. And burns are never neat. They're irregular, they involve curves of the body, they involve areas that are harder to access, so the process takes time. Another thing that people rarely talk about in surgery is smell. Every specialty has certain smells, and burn definitely has one. It's difficult to describe exactly. It's not like it's rotting. It's more like a burnt organic smell mixed with something slightly stale. And once you smell it once, you instantly recognize it the following time. Between the smell, the heat, and the length of the case, I started feeling something I had never really experienced in a very, very long time. I started feeling lightheaded. Now, there's a rule in surgery that people don't explicitly say out loud, but everyone knows it. If you feel like you might faint, you step away immediately, because the worst thing that can happen is someone passing out into the sterile field, or worse, onto the patient. So internally, I was doing this mental calculation. Okay, am I actually going to faint, or am I just uncomfortable? And I could feel that I was getting close to that line. Not fully there yet, but definitely approaching it. Meanwhile, the procedure's continuing, and I'm thinking to myself, okay, hold it together, breathe, focus, hydrate the following time. Once we finished removing the burnt tissue, the next step was placing something called Polynovo, which is a synthetic dermal matrix that helps guide skin regeneration. And this part honestly felt a little like arts and crafts. Because you take this sheet of material and you cut it so perfectly that it matches the shape of the wound. And you can cut different pieces, but they usually say it's better to cut this large surface area, or not even cut it, just get one, put it on the edge, and then follow the curve. And then if you can't follow the curve closely, cut and get a smaller piece to fit the rest of it. Burns are irregular. They wrap around the neck, they curve around the shoulders, they involve folds of the skin. So it does get quite challenging to get it laying flat on the wound bed. Then we stapled everything in place. And this is one of those moments where you step back and realize how incredible modern medicine is, because not that long ago, injuries like this would have been impossible to treat. And now we have materials to help the body rebuild the skin. Sometimes they even use fish skin. I'm not even joking. When the surgery finally finished and we stepped out of the operating room, the first thing I felt was the cool air in the hallway. And it felt amazing. It was like stepping out of a sauna. And I remember thinking two things at the same time. The first one was, that was pretty intense. And the second one was, I should probably have hydrated before the case. Jokes aside, rotations like this are part of surgical training. Every rotation exposes you to something new, something you've never seen before, something that pushes you out of your comfort zone. And sometimes those moments are the ones where you learn the most, even if you almost pass out in the process. So, the confession of the day. Burn surgery taught me two very important things very quickly. First, the human body is incredibly resilient. And second, hydrate before long case is incredibly and absolutely essential.